So I'm Lonna Gordon. I'm the Chief of Adolescent Medicine here at Nemours Children's Health in Central Florida. Um, I would say that, in terms of thinking about my research focus, I really focus on thinking through that bridge between population health, as my specialty is a population-based specialty, and thinking about communication between patients and providers around things that are difficult. And so specifically talking about a community-based research project that's looking at specifically gender diverse adolescents. And so we call that study the VIBES study, which VIBES, I actually always mess up what it stands for, but it's viewpoints and interactions and behaviors in sexual minority youth. Yeah. And so that's kind of why we called it Vibes. But in terms of, just understanding disclosures, this was funded by the University of Central Florida College of Medicine, as well as Nemours Children's Health through a collaborative research pilot program. So, one of the things that really want to focus on today is thinking about how do you recruit from study participants who are from historically marginalized groups and how that can be challenging, and then the impact of sociopolitical context on scholarship. So, just as kind of a little bit of background for those of you who may not be as versed on this particular topic, gender minority youth have pretty significant health disparities in compared to their heterosexual and sexual minority, their heterosexual, sexual minority, and cisgendered counterparts. So, just by being a gender minority, even within the LGBTQ community, those young people tend to experience increased barriers in healthcare utilization, but also their ability to effectively communicate and form relationships with providers. And that usually is resultant from a couple of different factors: lack of provider competence and cultural humility around the subject matter, discrimination and stigma that they have experienced both in society as well as that they may point to in the healthcare system, as well as harassment in healthcare settings. So, there's previous work that's been done that shows kind of some of the challenges that happen to young adults when they are interacting with healthcare providers. And so, one of the things we sought out to understand was kind of looking at that younger age group. People who are still reporting to care with their parents. Do they find similar challenges or are there dissimilar challenges? And so, when we kind of did qualitative interviews with young adults, these were kind of the five categories that previous research from our group has found in terms of areas where healthcare providers feel and young people tend to have a disconnect, leading to lack of psychological safety in the encounter. So one is just fear around disclosure and judgment, use of incorrect names and pronouns, the presence of parent or a lack of private time, concerns about confidentiality subsequent to that, and then patients having to educate providers on kind of what they would need in order to advance their care. So the goal of this particular study was to understand the key factors that were related to building effective relationships with pediatric providers for diverse youth populations of both sexual and gender minority. So first, we wanted to kind of understand that by identifying the factors that kind of facilitate as well as the factors that impede patient provider communication. And then secondly, we wanted to understand what are those factors that facilitate and impede effective patient provider relationship. Do they differ depending on kind of racial and ethnic subgroups or being sexual minority versus gender minority? So essentially thinking about the LGB component versus the T plus component. So the goal was to recruit 100 LGBTQ plus youth from nationwide. They would have to kind of click on an ad. They'd have to then do a Qualtrics eligibility screener, because on the ad we wouldn't want to let people know explicitly who we were looking for, to prevent people from kind of gaming the system secondarily. Then they would do a telephone screening and consent call, and then they would actually have the hour-long study interview call. So our inclusion criteria were that they had to identify as LGBTQ. They had to be between 13 to 17 years old. They had to live in the US but could not live in Florida. They also could not have a parent who was residing in Florida. They had to have visited a pediatric healthcare provider in the last 12 months, be fluent in English, and have internet access. So I think probably most of the inclusion criteria make a lot of sense to just hearing about the study, but you may be curious as to the piece around, living in the US but not in Florida and not having a parent residing in Florida. And that is definitely one of the spaces where sociopolitical climate impacts the ability to do community-based research. So, as many of you may be familiar, when doing adolescent research, it is really important that you have a waiver of parental consent and that the person who's doing the consenter is the adolescent, very similar to what's happening for them in clinical practice in the healthcare world. It could pose actually great danger for a young person who may not be fully out to their family to be outed by a research study. But at the same time, understanding the perspective of youth who are maybe not in the most supportive familial environment is really critical to helping inform healthcare systems on how to best meet the needs of LGBTQ plus youth. And that was important to, in the research study to be able to waive that parental consent. However, Florida law, prevents you from providing any kind of thing that could be perceived as education around gender or sexual orientation without parental information and being informed. And so as a result, we had to exclude young people who lived in Florida, as well as young people who have a parent residing in Florida. That definitely was challenging in terms of thinking about the fact that as researchers, we were all based in Florida and thinking about zip codes that we, or sorry, not zip codes, but area codes we were using to kind of contact patients and put on the flyer to make sure it was relevant and salient to the people who we were trying to recruit so that they wouldn't think it was kind of fake or clickbot. So things to think about there. So some other unique methodology concerns that we had were thinking about how do you recruit young people? So one of the ways that we knew we were going to have to recruit young people for this nationwide study and something we'd done before was thinking through was the use of social media. As you can imagine, adolescents and young adults are not interacting with research recruitment in the ways that you would typically expect when you're directly marketing to them. And so we needed to meet young people where they are, and that is on social media. And um, so that is kind of one of the that was one of the factors in that from that perspective. So, one of the things that we did in order, to kind of really work with that is worked with a graphic designer to be able to prepare and create kind of ads that would appeal to the young people that we were working with. You can tell that this does not, look like some of the typical marketing materials that we use typically within Nemours. And so that required, some steps in terms of getting marketing approval that indeed this was not, marketing that they would be able to um, support and create, and also that like obviously that Nemours' logo and would not be on it, which was something we didn't want anyway. We did not want it on either of the institution's logos involved in the study to be on the ad, but just getting the approval for that and that and kind of making the case for why that was important for gaining trust in this community that we were trying to recruit from. So we had some predictable barriers, right? So we predicted for sure that, UCF being a state institution, that Florida's barriers on DEI work in state institutions was going to be a barrier. So we decided upfront we were going to address that, hence the exclusion of Florida, the HB 1557, the Parental Rights and Education Act. So that's what I alluded to around the informed consent process and making the decision that if someone's parent resided in Florida, we also needed to exclude those participants. And then, thinking about the waiver of parental consent, we know that whenever you're working with waivers of parental consent, that can be a challenge, particularly if you're working with IRBs that are not as familiar with that process. And then finally, we knew that we needed to get diversity in our sample. And, from previous research, we know that both, for research as well as other published studies, we know that getting LGBTQ, particularly from African American and Latino ethnic and racial heritage is quite the challenge, as usually we see greater disparity, but important because we see greater disparity in those communities based on other healthcare research. But at the same time, there's a perceived lack of safety that's to a greater extent for individuals in this community. And so trust for community-based participatory research can be more challenging. So we then hit some unexpected barriers. So May 4th, 2023 was when Florida's law changed around provision of gender affirming care to youth. And that actually set off a wave of concerns within Nemours as a clinical institution around this research being conducted and whether or not that would, jeopardize our clinical work or put us at risk. So we had to halt the studies while that was kind of sorted out by the legal team and kind of thinking about clinical interests of the organization and research interests. So, fortunately, that was able to be sorted and kind of, able to kind of determine that these are actually separate things. And so, therefore, the legal change in the kind of care that young people are receiving should not in any way impact the ability to do legal research, engaging in young people, particularly since we were not recruiting individuals in the state of Florida. Um, then also, as you all probably know, there's been a lot of focus on social media and teens being targeted by social media. And so as a result, we ended up with a lot of blocks, as that was going through Congress in terms of social media companies changing their algorithms. So young people are typically on social media in the form of Instagram and TikTok and Snapchat, with TikTok and Snapchat being more commonly used than Instagram, and then Facebook really not being something that young people are on. But in terms of places that you can place targeted ads by age group, Facebook is the one that allows you to do that. And then and basically Instagram, TikTok, and Snapchat stopped allowing us to do that partway through our recruitment cycle, and our recruitment very much dropped off at that point. And then finally, when thinking about gender diversity in our sample, one thing that we had not factored in was just who's known to be on social media. And so we now, we recognize and it's published that who tends to be on social media are people who are cisgendered female girls when we're thinking about that age group of adolescents. And so as a result, we were trying to recruit a diverse sample where we had individuals who were cisgendered female, cisgendered male, transgendered female, and transgendered male. And we really struggled um, to recruit transgender female and cisgendered male individuals. So essentially, both individuals who were natally born with XI chromosomes. And so, that was definitely a challenge that persisted throughout the entire study. And then finally, we had higher than anticipated attrition. So, many people who would click on the ad, take the Qualtrics survey, screen positively in so they could be, further contacted, may even go through the consent form, but then, would not complete the interview. That tended to be the biggest point of attrition. And, in trying to understand the why behind it, we would make 3 attempts. We would ask people for best times to contact them. We had very flexible times that we could that we could conduct these interviews, recognizing that young people would usually want privacy. And so times when young people probably have biggest privacy is between, probably 2 to 5 on a weekday when, they're kind of home from school, but parents are not home from work. And so that was indeed the bulk of the time that we received interaction with our ad, and then that was the most commonly time that we scheduled that interviews were scheduled, as well as consent telephone calls. So in looking at the geographic spread of, kind of our responses, we got 247 responses. 6 of them chose not to continue with the screener. Of the remaining 241 people who responded, all but 1 were fluent in English. So there were 240 interested participants who were also fluent in English. 192 of them answered that they were between the ages of 13 to 17. And then you can kind of see in red the spaces where we had responses from. And well, I should say all of the spaces that are red or green are where we had responses from, but red are the places where we had respondents from. And then green was the area where people were ultimately able to complete interviews. So you can see that overall we had, fairly diverse national response rate. However, in terms of completion rates, a lot of our individuals who were able to complete the interviews really congregated in the Midwest, California and Washington, which were expected for us. We were surprised by Alabama, Mississippi, and North Carolina, but happy to see them included. And then we were surprised that that there were a lot of individuals in kind of that middle Northeast area. So, Pennsylvania, New York, Massachusetts, Connecticut, that were not that did not complete. Um, surveys for us. Overall, as we kind of mentioned, we did struggle to find people who were assigned male at birth. So the vast majority of our respondents were assigned female at birth. We were very proud that we got kind of an equal mix of individuals who were cisgendered and transgendered. Um, and then in terms of gender identity, we were also really happy with that robust 25, almost 25% of individuals who identified as being non-binary and queer. So we're able actually to recruit a really diverse national sample, but definitely, in thinking forward in future endeavors, thinking about how do we reach more of those individuals who are assigned male at birth. In terms of our racial ethnic breakdown, um, we did actually get a large percentage of individuals who identify as Hispanic. However, in racial breakdown, we did struggle to identify participants who identified as being Black or Asian. We would have liked to see those numbers more aligned with national data in terms of representation. So a couple of things that we, did to try to improve our recruitment was pivoting our marketing. So you kind of saw the first ad that we used, the first image, that we used, and then we tried to kind of change the picturing in the marketing to try to recruit more people who were assigned male at birth. And by changing to these photos, we were able actually to get a better percentage. So at the time when we made the pivot, at that point we were at about 5% of our study cohort being assigned male at birth. And as we showed you, we were able to get to about 20%. So things for future consideration, just thinking again about being intentional about the marketing. We were intentional about showing we wanted younger participants. That was something that we had struggled to recruit in previous studies. And so we had intentionally gone with someone who was younger looking. But we realized with going with someone who was younger looking and maybe more femme identifying, that at first maybe that caused us to get more individuals who were assigned female at birth. And so we, kind of tried to change our imaging to individuals who were more masculine looking. It was very hard to find a stock image of someone who was assigned male at birth who was also younger looking. So just things to think about in future recruitment. And then just thinking about, kind of challenges in contacting. So it took on average 2.7 attempts to contact someone or to get them to be able to complete the interview. As I mentioned, most of the respondents wanted to schedule on weekdays between 3 to 5 when they had the house to themselves. So, just really having our research assistants prioritizing that time to be able to work on this. Initially, we had research assistants who were primarily grad students who had some more flexibility in their time, but we also had research assistants who were that were helping with calls who were residents and medical students, and they were not as able to be as engaged because, of course, 3 to 5 they have the exact same challenges that we did as the PIs in terms of having other work-related responsibilities during that time. So just again, something to consider when thinking about, how do you meet participants and potential participants where they're at. Um, I think that this was just kind of helpful to kind of again highlight the diversity of who ultimately participated and kind of seeing the spread of the age, in that, we really did get a nice spread across the 12 to 17 age range that we were looking for. And so I'll leave it there with just some other acknowledgments of the, entire research team. And at this point, turn it over for questions.